Well, everyone, I am super excited because we have Sharon Weizenbaum here from it's the director of the White Pine Institute in Massachusetts, USA.
Yes.
And we've never spoken before. We've conversed on email and tried to get the time zones correct, which has been an interesting process. And I was just saying to you that I've brought this thing. So your translation of Chu Xiaomai's work, and this is this is one of my prized possessions. It's the only thing I kept from school, in terms of handouts and things like that. This is your translation of a few cases. There's 20 cases or something like that there. And so tell me about that work. When did you start that? You said that was one of your first translations?
Yes. Let's see. It was in 1990, 91. I had studied some Chinese by auditing classes at Smith College, but I was really not good at Chinese language. And so I was living in Hangzhou, and I had the opportunity to study with Dr. Zhou Xiaomai, and I got a copy of her book, and I couldn't read it at all. So then when I came back from China, I was pregnant, and I remember going to tea houses and just working on it. And I had a little dictionary, and the first thing I did was translate the table of contents, which probably took me days because I really knew so little about reading Chinese back then. And the table of contents just got me going. Like, I want to read this, and the only way I can is if I translate it. And I would still say that one of the reasons I translate things is so I can read them, and that as I'm translating them, I can't read them. I have to turn it into English and then go back and read it. Like, you don't actually get a chance to read it as you're translating because it's such detailed work. But I definitely have gotten a lot faster, and I did end up translating almost her entire book, her experiences in gynecology, and really, like, her methods are sort of a foundation for the way that I've worked all these years.
Well, I'm so grateful. I mean, as a student, I had quite an experience with this translation. So it's one of the strongest memories I have of being a student. I remember reading in class and reading through the case studies and reading the formulas and how she came to those conclusions. And I don't know what happened, but I could, these extra senses started to develop. I heard music and I saw all these colors, and that was the moment that I realized that Chinese medicine was a true art form. It was literally that translation that happened for me. So I'm so grateful for that, for you to bring that to the West. And the same sort of thing happened with Zhang Guanjing's formulas, but this was my first experience with that. So I'm very grateful. So I encourage the students out there to have a look at this as well.
That's really great. Yeah, I didn't even know that these translations were handed out in schools. So that's really good. It must have been one of your teachers was a student of mine or something.
Yeah. Bettina, I think it was Bettina Brill that gave that course, or Robin, maybe. I'm not sure who.
Yeah, maybe. Yeah. Interesting. Good.
So yeah. So today you're going to speak to us a little bit about one of your favorite formulas. What are you going to speak to us about today?
I'm going to talk to you about Sunni-san. It is truly one of my favorite formulas. And I think something I like about it so much is that it's such a simple and common formula that, people don't really think about it as a powerful formula necessarily. It's kind of a, considered like a liver qi stagnation formula or something, and also something that's inside of other formulas, but not a formula in its own right, because it's such a small formula. So it's like in Chaihu Shugan-san or shui fujuyu tong, you know, that kind of formula. But I think it's underrated. So when you asked me, that's the formula that came to my mind. Yeah.
Yeah,
Yeah.
it is a terrific formula. There's sometimes these simple things, they're so often the best. You know, you get these really complicated things and they end up tasting like mud, but you know, it's like cooking, you know, sometimes just very simple ingredients just make this, you know, like a pasta sauce, you know, it's just
Yeah.
tomatoes and onion and a couple of things, and it's absolutely with in the right proportions. It's absolutely perfect.
Well, that's a great metaphor for it. Yeah. And also I think I'm sure you've had this experience that when you have a patient that you have an amazing result with, you start to develop an affinity for a formula. And when that happens over and over again, you just feel like that formula is one of your best friends, you know, it's like your magic wand or something that you keep in your pocket. And that's the way I feel about Sunni-san. And, you know, and even I've had some really complex cases that have resolved with Sunni-san as sort of the key formula. You know, so it's not just a kind of formula to relax the liver or something, you know, I think it's, when you dive into it, it's got a lot going on. Yeah. Yeah.
Please expand. Please tell us.
Okay. Yeah. Well, yeah, I think, you know, one place to start is just looking at the ingredients. And, you know, of course, it's got some teeny tiny formulas inside of it. And I consider 2-herb formulas to be teeny tiny formulas. So there's Xiaoyao Gansao's tongue is inside of Sunni-san, and so is Zhishu Xiaoyao-san. You know, and so if you look at the actions of those 2 little formulas, you know, where Xiaoyao Gansao tongue is Bai Xiao and Zhi Gansao, and Zhishu Xiaoyao-san is Zhishu and Xiaoyao. You know, so there are these 2 tiny formulas inside of it, and so I think that tells us a lot about what the formula is for. So if you look at Xiaoyao Gansao Tong, it's really the formula for relaxing someone's muscles. You know, it nourishes the muscles and relaxes spasming, you know, and hypertonicity in the muscles. And that can result in you know, spasms like Charlie horses, or a tight back or a tight neck or generally tight muscles. But it can also result in a failure of muscles to contract properly. You know, so Xiaoyao Gansao Tong is really good for constipation because it helps relax muscles so that the peristalsis can naturally happen. You know, so it's something we don't think about, that when muscles get really tight, they not only are too contracted, but they also don't contract in the physiological way they're supposed to. They're sort of locked up, you know. So the Xiaoyao Gansao Tong, it just really like relaxes muscles so that they can respond how they're supposed to all over the body, you know, including the uterus, you know, where if the uterus is really tight, then Xiaoyao Gansao Tong can relax it, either to help stop contractions that are happening when they're not supposed to, or to help the uterus contract the way it's supposed to. You know, it works both ways. And then the Zhishu Xiaoyao-san is a really good formula for abdominal pain. And, you know, John Jing says that it's for postpartum abdominal pain. And how I take that, all the things that are sort of for postpartum women, is that it's for people who have a tendency to both be very deficient and have stagnation. You know, that postpartum is sort of a code for deficient and stagnant, you know, and because that's kind of the nature of postpartum women, you know, the kinds of problems postpartum women get. And so, of course, it's not just for postpartum women. And so that formula is very good for helping to move qi in the abdomen, with zhishu being bitter and cool, but also, according to the Mini Beilu, it's also sour. And I think of zhishu as also really helping peristalsis function properly. Um, so it's not just bitter and in a purgative way, it actually helps strengthen the large intestine. So, it just gets things moving in the abdomen the way that they're supposed to. So you can see how those two formulas together with three herbs, Zhigansao, Zhishi, and Baishao, all can work together to really smooth flow. And then you add chaihu, and the way that I think about chaihu is, um, that it's that this pivot function in the body that helps to kind of get the ministerial fire into the right position, because the way that I think of physiology is that the yang is always coming down from heaven, and it has to pivot in order to, instead of going down, it has to now go up, like, and become the fire under the cooking pot of our body. And chaihu sort of smooths that pivoting so the ministerial fire can come into the right position at the root of the body in the dantian. So um, it sort of opens up all the hinges in the body. The symptoms that show up when the pivot isn't working often show up in pivot areas, which can be, the lower abdomen, the groin, the armpits, the neck, the eyes, the jaw. And so chaihu sort of, it's almost like greasing the hinges in the body. And so that things can, go back and forth with ease. Like if you imagine a door that's sort of stuck, nothing can move in or out very well. And you oil those hinges and now things can move smoothly. So a lot of functions in the body can open up. And so you put all those together and it's, you can just sort of imagine how much it can help things start to flow. So there's the basic formula that it is taken with some rice congee as well, traditionally, which I think also just adds like a kind of a nourishment, increases the fluids in the body. It helps the body absorb fluids more. It gives a lot of sweet nourishment. It doesn't have to be taken with a rice congee, but it really does help the action of the formula to do that. Even some hot oatmeal is really good. So there's kind of that structure of the formula, which I think is really ingenious, the way that John Jonjing's formulas often are, just taking a few common ingredients and it's sort of miraculous. Um, and then there are John Jongjing's modifications, which he lists in the clause, which is the clause 318. And those are ingenious too. And some of them I have a lot of experience with. Some of them I don't have so much experience with, um, but you can imagine if things are kind of hypertonic and the pivots are stuck, that it could very much inhibit urination, and it's not because of this spleen dampness leading to all this water. It's just because everything is really tight. And so Sunni-san loosens things up. And then if you add fooling, it can very much help to disinhibit urination. So I've treated so many prostatitis patients with Sunni-san. It's amazing for that, and the way I think of like an enlarged prostate is that, usually the men that come in, they say, yeah, I have inhibited urination. It's because my prostate's enlarged. And the way I think of it is that the inhibited urination is what's causing the enlarged prostate. So we don't have to do anything to make the prostate smaller. You have to disinhibit the urination and open up that area. And so it's really quite amazing when you give Sunni-san, if it's the right formula, which you can tell from the signs and symptoms, and pulse is really important. But I've seen often it is the right formula when men complain of enlarged prostate and prostatitis. And so giving Sunni-san, it like opens up the pivot and helps things to relax and flow. And then Fuling can help to disinhibit the urination, and lo and behold, the prostate isn't enlarged anymore, without doing anything directly to try to soften masses or, get rid of lumps or anything like that. I've had that experience just any number of times. So that's pretty cool.
And so can I mean, this is such a fascinating formula for so many ways, especially, my focus has always been sort of a classical administration and this kind of, the technique of administration. And this one was really hard at the beginning. So I just want to ask you a couple of questions. So one is about Xiaoyao. Xiaoyao, this Bai Xiao, Che Xiao idea.
Yeah.
I'm of the thought process that Xiaoyao is Che Xiao, and then because there was no difference between that. But in Zhe Xiaoyao-san, I think it actually calls for Bai Xiaoyao. But in Sunni-san, it just says Xiaoyao. So if we assumed, in theory, that Xiaoyao was Che Xiao, and we're using it in a san, which would be bitter, but if we cooked it, it would be sour. So if we're looking at Sunni-san here, we've got a san, but we're actually using, but it makes more sense to use Bai Xiao because it's a cooked formula. It's a cooked powder, which is such a unique administration of a powder. So I personally came to the conclusion to use Bai Xiao in that formula as opposed to Che Xiao and then cook it. But I've experimented with both, and it's been interesting to see in clinic. Obviously, better results with the Bai Xiao cooked in rice. And this cool white rice decoction. Unfortunately, we don't have the tongue yijing anymore to find out exactly what a cool white rice decoction is. Do you have any thoughts on that? How do you make, you mentioned congee before. So how do you make this cool white rice decoction?
Yeah, all I do is have my patients take it with a decoction, so that they're bringing nourishment into their tummy. So I'm not cooking any herbs with the rice congee.
Okay, so you're making Sunni-sans as a like as a bulk herb or as a powder?
Both. It depends on the patient. I've had a long history with powdered extracts, and so sometimes with powdered extracts, but usually I make it up myself with individual herbs, and I vary it depending. Like if somebody has more of a loose stool, I'll use Chao Bai Xiao. Whereas if somebody, has more of constipation, then definitely fresh Bai Xiao. And if it's tending more towards heat, I would use Che Xiao.
Cool.
So I just think of it that way. Yeah.
Beautiful, love it. And then taking it with the congee at the same time, just having that nourishment with the formula.
Yes, almost kind of like a Guizhotong kind of technique, where you're warming your middle and bringing in nourishment. And yeah, and to me, the rice, I think of it as a chalky herb. Like I like to think about chalky herbs, and where like something like tianhuafen, fuling, gegan, they're all kind of chalky herbs, and rice is like a chalky medicinal as well. And what I mean by that is that it's absorptive, and certainly you can see when you cook rice, it absorbs the water. And so I think of it in our bodies as increasing the absorptive capacity of the spleen, so that, when we drink water, we're able to absorb that water. And I think like Tianhuafen and Gegan work the same way, like they increase the absorptive capacity of our stomach. So that's how they treat thirst, and that's also how they treat diarrhea. And actually, I often will use Tianhuafen with Sunni-san because of the way It helps if somebody's thirsty, and then I would add Tianhuafen to the formula, because it's going to increase the absorptive capacity of the fluids. And so, very commonly people, they not only have kind of hypertonic muscles, but if the muscles are really stiff and hard and they have thirst, then Tianhuafen, it's going to bring that moisture into the flesh and soften the muscles, which is, I think, why it's used for soft tetany, like in Gualo Guizhitang. That it brings this cool moisture into muscles that have gotten stiff because of heat. I have a really interesting case where that idea was being used, where I used both Fuling and Tianhuafen, which is really common modification. And actually, I learned from Dr. Zhang about using Tianhuafen. Sometimes I use Muli as well, that combination with Sunni-san. But this, you want me to tell you about this case?
Yeah, it sounds great. It sounds very interesting.
Yeah. This was a 16-year-old kid who had to stop going to school because he had epididymitis, which is an inflammation of the tube from the scrotum to the penis. And he was in constant pain. And it got so bad he couldn't go to school. And he had been very athletic. He was a ultimate Frisbee player, and was, thinking about going to college and trying to get athletic scholarships, and he couldn't do anything. And actually, being active made it worse. And so he came to me, and he had gone to the doctor, and they had given him something that it was like a salt pill, and they told him to take this salt pill and then masturbate. And it was almost like a purgative thing, like Meng Shao, let's see if we can, as if the pain was like from a blockage, like maybe we can get the blockage gone. And so that was kind of interesting, and that actually made it worse, which to me was diagnostic. If you purge out and it makes it worse, then it's not from a blockage. And so when I did the intake with him, he was very thirsty. In fact, his lips were really chapped. And this had all started after he had gotten mononucleosis. And I asked him about what happened with the mono, and he had had a really high fever for several days. And so I thought, I think that what happened is that his fluids got damaged from the high fever, and that he was still not absorbing water. And he had what I call dispersion thirst, which meant that he felt thirsty, but he also peed frequently. And he had inhibited urination as well. He was frequent, but it was hesitant. And so what I'm thinking, and then his muscles all over his body are so tight, like he stretches all the time and it doesn't do anything. He just feels like he's extremely tight. So the way I was thinking about it is that he was not absorbing fluids. And so everywhere in his body was, all his muscles were, the tai yin muscles were undernourished and kind of hot and dry in that Tianhuafen Gegan kind of way. And that the fluids were going right through him, but they were pooling up in his lower abdomen. And so also it was in a pivot area right in his groin. And so to me, giving Sunni-san was exactly right, because it was going to nourish and soften his muscles, and also really oil the pivot areas so that they moved more freely. But also I added to the formula the Tianhuafen to help him absorb fluids back into his muscles, to relieve his thirst and soften his muscles even more. And I added Fuling, which is one of the modifications from the clause 318, that if there's inhibited urination, add Fuling. And it's very common to have inhibited urination with this pattern because it's all blocked down in that pivot area. Anyway, so another interesting thing about him was that he also had, now I can't remember the name of it, but it's chole something, but it's an inflammation of the tube that goes from the gallbladder to the liver, and it gets really inflamed to the point that it can get blocked and you can develop cirrhosis of the liver. It's quite serious. And he had discomfort in the right liver gallbladder area under his ribs. And that was another key about it being related to the Shaoyang, you know, that it's rib side, it's groin. So I thought, oh, all these tubes in his body are kind of getting hardened and blocked. So my idea was like, wow, maybe I can soften them just by like nourishing the blood in this Baishao kind of way that relaxes muscles and moistening the tissue so that it flows better. And it was very successful. Like right away, he started to feel his urine was less inhibited. He was less thirsty. The pain was going down. And basically he made a full recovery and did not have that disease anymore. And it was real interesting for me because the idea like someone coming in, I've got epididymitis, and it's like, how do you treat epididymitis? Like, I don't know. I have no idea how to treat it. I had never treated it before, but that doesn't matter from a classical perspective because I'm not treating epididymitis. I was treating this dried up flesh and, you know, blocked Shaoyang. That's what I was treating, and that's what explained the disease, which I love about our medicine. You know, isn't that the best that
Just great.
Strange cases can come? Yeah, yeah. So.
Yeah, it reminds me of a case I had where this young boy, because that ability for these young men, you know, especially these athletes, this is almost identical case, but he did manifest differently for my patient. He was just constantly running, you know, just drying himself out, drying himself more and more and more. And then he had this, I think, you know, a typical thing, you know, he's out running in the rain and then sweating, and then he came home and then didn't take care of himself, and then woke up in the night just with these massive muscle spasms, huge cramps all through his back, and so bad that he would sit on the table and then the spasm would just throw him up into the air. And it was just this poor kid. He couldn't sleep. He couldn't do anything. He was just, it would happen every, you know, 5 minutes, this constant, just massive spasm, and then relax, and then cry, and then spasm. And then it was the worst case I've ever seen. And he'd been and seen everyone. He came to see me, and I ended up using Sun, you know, which is this component, and it totally changed his body. Just everything just completely relaxed, and it was funny. It's just amazing. But
isn't that amazing?
Listening, and super complex case. You've never seen something as bad, and you know, a couple of herbs and off you go. You know, it's just
I know. It's so magical. To me, that's the magic of the classic formulas, when you really start digging into them and understanding them, and really when you recognize, oh, it's this pattern, you know, it's such a good feeling.
You know, when I first started prescribing Sunni-san, I didn't like it. I really didn't like it, because everyone I gave it to just came back with muscle spasms and cramping and diarrhea and just irritated. It just didn't fit with anyone. They said, oh, I took it for a couple of days. Oh, it made me feel so terrible. And then I said, oh, okay, it's because I'm not using the rice. So then I used the rice, and it hasn't been a problem, which was really interesting.
Oh.
So, you know, that little detail, we forget that the rice is part of the medicine. It's part of the formula. It is one of the ingredients.
Yes.
So yeah, it's very, very, very cool. And so, and with the chaihu as well, you know, often people use the wrong species of chaihu. They're using, you know, the southern chaihu, the nan chaihu, rather than the bay chaihu, which is a totally different species. And you know that chaihu is a venting process. You know, you talked before about how it you know, how it regenerates and recharges, and it's a pioneer species. That's what it does in nature, doesn't it? You know, it's a pioneer species, comes into an arid, just devastated area and brings forth the new, which is very much what the formula does.
Oh, oh, cool. I didn't even know that about Chaihu.
Yeah, yeah. I think it says it in the Shetland Bensajing,
Yeah.
you know, gets rid of the stale and brings forth the new, and that's what it is in nature as well. Yeah.
Yes, yes. Yeah, that's really beautiful. Yeah, I love that kind of thing.
Yes.
Yeah.
And so and so and so what kind of things do you what kind of range do you think Sunni-san has? I mean, you know, it's not necessarily, oh, it treats, you know, from this condition to that condition. You know, what other things have you seen it used for?
Yeah, so mentioning prostatitis and growing kinds of problems, but also digestive problems. I had a patient, she was so worried because she had had a very rare and challenging form of cancer in the past, and she just had abdominal pain that would twist and writhe like a snake tying up knots inside her abdomen, and she had to be super careful about what she ate. And even then she would get an episode at least once every 2 weeks. And, you know, from the pulse and the abdomen, which are really key for diagnosing the pattern for me, you know, it was, I diagnosed a Sunni-san pattern, and I was modified somewhat, but that was another case that was just like miraculous. Like her abdomen just started to unwind and relax, and, you know, things started to move, and it wasn't about what she was eating at all. You know, it was more the Sunni-san pattern that had lodged in her body that needed to be resolved. Um, I had a strange experience with it, which I'll answer your question in a second about other things, but just going back to muscle spasms, there was a guy who came, and he was like traveled all over the world. So he came in, you know, was like, okay, I have this problem. And again, it was like really tight body, especially his legs. And he didn't sleep well. And, you know, and he's like, you know, give me some herbs and now I'm going to be gone for 6 weeks. You know, those kinds of patients that want you to just fix them, you know, in one, give me the right herbs. But so I did give him a few weeks worth of Sunni-san, and I know it was modified. I think I even modified it. You know, there's the Suwei Jembutang. Do you know that formula? The
Oh,
4-flavor supplement walking decoction. It's a Dr. Hong Hong's formula. And it's got Danshen, Chirshao, Huainyoshi, and Shihu. And it's for bringing good blood flow to the legs. So I don't remember exactly what I think I added Huainyoshi and Shihu, something like that, you know, just with that idea. And he came back after 6 weeks and said he took the herbs and he started getting these weird, bubbly, muscly spasms in his legs that were like there was an alien living in his calves, you know, and he could see it moving, and it was kind of painful and alarming, but he had some intuition like, this is good, you know? So he kept going with the herbs, and after a couple of days it resolved, and his whole body just like had a nice sweat and it relaxed. And that was really interesting. Like I had no experience with it. Have you ever seen that happen before? That there's a kind of a weird unwinding. It felt like it was unwinding.
Definitely. I've actually, my father-in-law is going through that experience at the moment in his shoulder. He's had all these shoulder reconstruction and shoulder surgery, and he had lots of bursitis and all sorts of pain. And I've been putting on, after the surgery, I put him on Wangu Liaoxing-san, and that's the experience he's having. All these bubbling sensations all going through his arm, and it's just like, this is blood retention. Feels good. He said exactly the same thing. It just feels right. Like I'm not sure, but it feels like I'm getting more, and that's that sensation, isn't it? That I think it's just the capillary system just reformatting. It grows.
Yeah,
Like,
isn't that's
yeah,
wonderful. That's
the capillary
wonderful.
grows
I
like a
love your Wang song that you produce. It's
thanks.
wonderful. That's the Wang song I use in my practice.
Yeah, great. Yeah.
Yeah.
And with I was going to say something about Sunni-san. Now I lost my train of thought. I'll ask you about that.
Well, you were asking me about other things it could treat, and I think it's because it's such a small formula, it can easily combine with other formulas, and be easily modified. For example, no, I think of it as a really good formula for insomnia, especially insomnia that's worse with stress and where people have a real, that it fits the pattern. To me, it's like insomnia can come from so many different patterns that you kind of have to forget that the person has insomnia and just figure out the pattern and see how does that pattern explain their insomnia. And certainly Sunni-san can help explain it, but I've also used it like in combination with aspects of like Rentong is a really nice combination for insomnia. And also for, if the emotional symptoms are very strong, especially sort of premenstrual syndrome where there's a lot of, PMS can have so many different forms. It can be like a dark depression where you just want to curl up and you hate everybody, especially yourself. Or it can be a lot of anxiety and agitation and tension. Like I just feel so wired and tense. And in that kind of situation, Sunni-san can be really useful. And I've also combined it with Bai He, the lily bulb, to help if there's some heat in the chest causing some anxiety that the person just feels wacky and out of their mind in that way, then combining it with Bai He can be really a nice combination. And then it really easily blends with Guizhitong. You know, if there's like flushing up, and especially the tightnesses in the neck and shoulders, I I see it as really easily combining with that. Almost like Chai Hu Guizhitong, except it's Sunni Guizhitong. Yeah.
And, this associated with the emotional side of Sunni-san. I think that I mean, what kind of, when you talk about the pulse for Sunni-san, are you talking, which systems are you talking, or is it something that you've found that you've worked together, or is it a combination of things, or is there anything you're willing to share or about that in regards to that?
Yeah. Yeah. I mean, my own way of approaching the pulses in a very general way is just first, what I like to do is forget about the pulse until I feel like I understand the pattern as best I can. And then see, now that I understand the pattern, what does the pulse tell me? And how do I explain this pulse with the pattern that I'm seeing? And what does it add to what I should maybe be doing with the person? And so, and then when I'm feeling the pulse, I'm looking at what's happening with the life force. Like, where's the yang? What's happening with the yang in the body? So just asking that question. And then, with the Sunni-san, it's often a very wiry pulse on the left-hand side. And, and then if there's a lot of abdominal pain, usually that wiriness will go onto the right-hand side too, and so, it's just, what does that mean? It means like, well, in the wood element in the liver, things are, the life force is very constrained. No, like the wiry pulse means the life force is pushing against some kind of constraint.
Mm,
The constraint could be dampness, it could be tension in the body, but the life force is pushing against some kind of constraint. Where? In the wood element, in the liver area. And
mm,
if it's really affecting the digestive system, then it's going to be over in the earth area and it's going to be really wiry over there. Um, Now, if that's not what I find, but it's really from the rest of my diagnostics based on asking questions and palpating the abdomen and looking at the tongue, and then the pulse doesn't really fit with that. I'll, you know, I still might use Sunni-san, but I would modify it. The pulse will say, you don't quite have it all, if it doesn't fit with that basic wiry and the guan positions, is
mm,
mostly what I look for.
mm.
Um,
When you
yeah.
say,
And
when
that
you,
comes from, all kinds of studying for many, many years. Yeah.
when you use the word constraint, do you think, where do you think that constraint originates from? Do you think it's because constraint in my mind is kind of like, you've got this oppressive constraint or this repressed constraint, or, there's different origins of constraint.
Yeah. Yeah. And constraint isn't the best word because it's, often that character you is translated as constraint. And it basically means things are blocked and not moving well, you
Mm,
know. And with Sunni-san, it's partly that, but it's also this kind of tension,
mm,
like the liver is tense. And it's tense also because it's like dry, and undernourished. And so you want to be careful. Like you don't want to go in with a lot of opening pungent herbs if it's dry and undernourished, which is, I think, where Sunni-san is really great, because it nourishes and moistens at the same time as it opens up. It's very nicely balanced that way. So constraint is, um, if I was careful, I would probably use constraint to mean something that I want to use pungent herbs to open up,
mm,
and tightness or tension for that kind of hypertonicity where I want to nourish and
mm.
emoliate, almost like dried up leather, and I want to, add oil to it so it can get softer. So they're kind of opposite kinds of things. I don't know. Did that address what your question was?
I think it did. It differentiated the two things, and I think it definitely, like the difference between this, like you said, that pungent dispersal as opposed to the nourishment. I mean, you said it all. Yeah, yeah,
Mm-hmm.
yeah.
Mm-hmm. Yeah. Something I do with, for if, like the Sunni-san is kind of balanced in the middle between opening and nourishing, and it's really got a nice sort of up and down balance as well. And so you can kind of emphasize which direction you want to go depending on what you add. Like adding something nourishing and sweet like swanzaren or baihe is sort of going into the softening direction,
Mm,
So if there's a lot of tension and anxiety because things are dry and tight, those are good. But if you want to go in the other direction where it's more of a blockage, and someone is kind of repressed, and you can often get a feeling like, if you just ask yourself, what do I want to do? Like, do I feel like this person just needs to like express themselves more or have a good cry and then they'd feel better? Or do I feel like they need a hug and more nourishment? And if it's the former, then I've often added something I actually learned from Stephen Clavey, which is adding like He Huan Hua and Yu Jin,
mhm,
to, if there's a kind of a depression that's a Sunni-san pattern that I want to open up more, then
mm,
I love He Huan Hua. Um, and sometimes like the flowers like Mei Gui Hua, um, I often give that as a tea for people to take home. and I have them take it. This was something I learned from Huang Huang. He says he has a beverage that's his Sunni-san beverage, which is making a tea out of Meigui Hua, honey, and some mint, some peppermint, and that's Sunni-san in a beverage. And so it's good for Sunni-san people to drink, and some lemon also for the sour.
Mm-hmm.
Yeah.
Yeah.
And of course, everybody loves getting a little Ziploc bag with little pink rosebuds in them.
Oh, definitely. Yeah, it goes a long way. Go home and steep it all. We've had the wrong species of, speaking of Herpon, we've had the wrong species of Herpon for a long time in Australia. It's
Really?
Yeah, it's been.
What did you have?
Oh, I don't know
what were they sending you?
It was the Hong Kong version. I can't remember what it's called, the Mandarin for the adulterant is, but yeah. But anyway.
I know for a long time I would order He Huan Hua and get an herb that I just thought was He Huan Hua because that's what I ordered. And then Andy came to visit, Andy Ellis, who's kind of the big authority on herbs, you know, and making sure it's the right kind. And he looked and he said it was actually Ho Po Hua, not He Huan Hua. And actually Ho Po Hua it still worked. The Ho Po Hua worked, you know, it also has a similar opening the heart kind of action. But now I know what the Albizia actually looks like, and I get it from, you know, a good source. So yeah.
Yeah, when I first met Andy, we were talking about herbs in Hangzhou, and I thought I knew quite a bit about herbs, and we were chatting away, and he said, he was like, you know, what about this? What about this? You know, this adulterant, that. And we're talking about adulterated species, and then after a while, he looked at me and he goes, "Are you sure you studied herbs?" He's so good at putting you in your place, isn't he? He's just he can just cut straight through.
I met him my first year of acupuncture school in 1981.
Oh wow!
And he came to interview at the cooperative household I was living in while I was going to school, because he was going to go to the New England School of Acupuncture as well. And he was all registered, and then he actually decided not to do that and to move to Taiwan instead. And the rest is history.
Yeah, for sure.
Yeah.
Yeah, it's so great walking down the streets of Taipei with him, and he just runs into people and, I played basketball with this guy or this guy there. And he's the cousin of something. It's like, oh, this is great. It's stomping ground, you know, it's really, really interesting.
Yeah. Yeah.
Well, anything else you wanted to add, Sharon?
That I can think of.
Does anyone have any questions right now? Because I'm sure people have got questions for you.
Are people going to be able to ask questions?
No, I was just saying, wouldn't that be great if we could ask people?
Oh, I was going to say, I thought there was only the two of us here.
No.
All those secret people. Yeah, it would be great. And I would love to answer people's questions.
We'll ask people to comment, and they can ask you more questions and stuff like that. So where can we put your details in the notes at the bottom, and people can get in contact with you and ask you all sorts of questions about Sunni-san?
That sounds good. Yes.
That sounds awesome. Well, Sharon, thank you so much for your time. I appreciate it. I'm sure you're a very busy person, and I'm sure you know, everyone really appreciates you generously donating your time to the cause of getting some of these, you know, the chats about these formulas out. So really, really appreciate it. And very nice to see you and talk to you for the first time after, you know, such a great treasure I have here with my work in translation. So thank you so much for what you've done for the profession, and yeah, thank you so much for taking.
Thank you. Yeah, and thank you for taking all this time to do these podcasts. I didn't know about them until you invited me, so I'm excited to listen to more of them now. Yeah,
we've just done a few, so we'll just do them, and we'll just keep on see how they go. People got so much to say. You know, so people got so many little gems about individual formulas. I thought it's just a great way of just kind of nailing down a particular formula. All right, Sharon, until next
Okay.
time.
Bye-bye.
Thank you again.